afternoon. For those of you that have just joined the HFRCC webinar, you have entered into the Flint Community Webinar on Coronavirus. We are now at week 102, and we are excited that you've joined us to get credible information from our partners. This webinar is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. I'm so excited to have the opportunity to be your moderator for today. I am the founding director of the National Center for African American Health Consciousness and the co-director for the Healthy Flint Research Coordinating Center, the Community Core. We have not done this alone, however. We have had a number of partners, initially beginning with a team from the Healthy Flint Research Coordinating Center's core partners, the University of Michigan Flint, and Ann Arbor campus, Michigan State University, along with community partners. We desired early on March 20th of 2022 to bring a local context to this global pandemic. So every week we appreciate all of the partners who've joined us to help make this a reality. Could not have done it without you. And so today is no different. We are excited to have with us today representatives from Hurley Hospital, from Metro Housing, from Genesee Health System, from the city of Flint, the Genesee County Health Department, and the list goes on. So we're going to ask those of you that are joining us in the webinar, please put your questions in the Q&A. This team will be so happy to answer questions for you. Along with those of you that are in the webinar, if you are joining us by Facebook, we would also appreciate your involvement as well. Because today we will talk about COVID in terms of the workplace and community safety. We'll also be hearing information that will address what's being done for our homeless community during COVID. And we cannot forget, we are still in the midst of a pandemic. And the Omicron subvariant BA2, what is that? And what do we know about it? And of course, there are also really important equity updates that we'll share with you, in addition to what's available to us in our community as it relates to testing and vaccinations. We are excited today that in the midst of African American History Month, we are looking at what those health inequities are. It is no question that in the course of our data collection, there has been the issue of looking at data from the Black-white perspective. We now know that it moves beyond that. We have to also look at some historical facts. What did we learn from the past in terms of our health, and what will that do in shaping our future? So we again are commemorating Black History Month, those African Americans that we now say African Americans who sacrificed and gave so much for us in this community, in our country. And we really want to make sure that we acknowledge that. Today, we have with us a very special guest, Sean Egan, who is the Deputy Director of the Michigan Department of Labor and Economic Opportunity. We heard Sean share some information on one of our other community calls, and we felt it was really important that this information be brought to a larger group of our community. So again, we're asking those of you put those questions in as he presents this information, because these are really important items for us to understand. So we welcome you, Sean, to our webinar today.
Well, thanks, Yvonne. Thanks so much for having me. I really appreciate the invite and the opportunity. In addition to my role as a deputy director, in June of 2020, the governor appointed me as the COVID workplace safety director for the state of Michigan, allowing me the opportunity to not only have these conversations, but to work closely with DHHS, public health departments, and others to provide information, updates, and look at what's happening in our communities to try to make sure that we're moving forward together. One of the things that's really challenging regarding COVID is that it's really a public health crisis that impacts workplace safety. And keep in mind that just a year ago now, we started slowly rolling out vaccination, and that is really the tool that is going to help us continue to get through COVID and move forward. And we're seeing that impact as we work across the state of Michigan and Genesee County. And I have some Genesee County specific information I'm going to share in just a minute. But trying to navigate that, right now, we've seen updates in masking guidance from DHHS. We anticipate some today from the CDC. And all of that's going to have an impact on what we're doing. But workplaces are a little bit different. And we're going to talk about that. But for right now, we're seeing good things in the state of Michigan. This information comes from the DHHS statewide updates they do weekly. It's posted online at michigan.gov coronavirus. You can find it there. You can look at it. But like you're going to hear probably throughout the call today, the Omicron peak is starting to come down. We're starting to see case counts come down across the state. Positivity rates are coming down across the state. And hospitalization rates, most importantly, are coming down across the state. And that's wonderful news. For the Flint area, where they're lumped into a region, we're still seeing relatively high positivity rates and case counts, but that peak is coming over. Can you go to the next slide, please? And when we look at that across age groups, I'm going to ask you to kind of keep this slide in mind as we start talking about the workplace, and I'll share why in just a couple of minutes. We're seeing it come down pretty quickly across all age groups. Omicron was expected to be a pretty quick peak and a pretty quick decline, and that's what's happening. And that's good news. And I think when we look at the case trends by age group, what you can see there is that the highest cases were in the 20 to 29 age group, followed almost sequentially by 30 to 39, 40 to 49, 50 to 59. And this is important because those age groups are actually lower in the vaccination rate than older age groups. So we see very, very high vaccination rates for those that are 65 and older, pretty good between 50 and 64, and it kind of trails off from there, which I'm going to share with you more in just a minute. If you can move forward, please. The great news, though, is that as I mentioned, just last year, we rolled out vaccines. We all know that several months later, we started getting boosters. Those vaccines are having the impact that was hoped. They are preventing cases as well as severe outcomes. As you all know, when you're asked to get a flu shot or something similar, the vaccine itself won't give you 100% protection against infection. And we knew that with the COVID vaccine as well. But what we're seeing here is that it gives you a great amount of protection against becoming a case, a COVID case. And you can see that on the left-hand side of this slide. Those are cases based on vaccination status. The black line being those that are not vaccinated, the dashed line being those that are vaccinated but not yet boosted, and the blue line being those that are vaccinated and boosted. And you can see the vaccine having a great impact, even without that booster, to lower the potential cases. More importantly, it's preventing those severe outcomes. On the right-hand side of this slide, you see the deaths based on vaccination status. And as you can clearly see here, the black line representing the fatalities of those that were not vaccinated is far and away where this is occurring. The blue line is almost at zero and the dashed line is very, very low, meaning the vaccine is doing what we hope. It's preventing severe outcomes as a result of catching COVID. And that's important in our communities and across the state of Michigan to make sure that we understand that this is not going to be 100% effective to prevent you from potentially getting COVID, but more than likely, you are not going to have the ultimate severe outcome of a fatality because you are vaccinated. Move again, please. So DHHS is putting out a change in how they're evaluating where we're at with COVID and where we're going. They've broken it into 3 phases. It's going to be a little bit different than what you might expect to see in your workplace, but it's really focusing in now on some of those hospitalization metrics and maybe less about case counts just in general, because we have vaccination as a tool, as well as better treatment options than we did when COVID first started coming on the scene. We've seen hills and valleys, and we're starting to see a change because of vaccination on the severity of the virus and how it's impacting our hospitals, as well as that ultimate outcome that we want to prevent altogether, which is a fatality. So you're going to see information kind of change from DHHS as we roll through various aspects of our continued fight against COVID in our communities, just being ready, responding when surges start to happen, like we saw with Omicron, and then what we do after we start to recover. So I make this point to share with you that you're going to hear different information about social distancing, face coverings, masking, N95s, and it might change at times. And that's important to understand that that's not because we're just guessing or we don't know what we're looking at. It's because the peaks and valleys are going to be different, and the protecting the hospitalization and our hospital capacity is really going to be a key component moving forward. So I think you've seen from DHHS for the public some loosening on masking requirements in different places, you may see that go back up, and be prepared to respond to that, because that's really going to help us keep those peaks down if we get another potential spike or surge in COVID. It's also going to help us get through them quicker. Next slide, please. And what I'm going to talk about in the workplace, also understanding your community. That's really understanding your risk, both in your household and personally, from catching COVID or being exposed to COVID. This graph here is available right online on that coronavirus website. It's a great graphic that kind of gives you what risk might be in play depending on what it is you're doing. So if we look across the top scale, low risk settings, outdoors, not many people, a lot of spacing, all that kind of stuff, things that we know about COVID. On the right side, those are indoor spaces that are crowded, poorly ventilated. Maybe you don't have the freedom to just leave if you need to get to provide more spacing. Maybe you're kind of stuck in an environment. And then likewise, if you are vaccinated and boosted, you have a lower risk in any of those settings. If you are not vaccinated and you have risk factors, you're going to be at the highest risk across all of those types of settings. And I know you've been seeing this information for a long time. It's pretty straightforward, and it's good that it's pretty straightforward at this time. Because we do have vaccination, we have treatments available that lessen the severity of COVID, we do know what happens. This is a virus that we expel from our bodies. It becomes aerosolized either as droplets or smaller mists that transfers to somebody else when we're in close proximity. And then we can contain some of those particles if we socially distance and wear face coverings. So all of us now know what to do to avoid or prevent the spread of COVID. And on the other side, we have great vaccinations and treatments to help us if in case we do catch the virus. Move forward, please. So let's talk about the workplace. As I showed you on that last slide, kind of look at risk levels, indoor, outdoor. If you work outdoors, it's going to be a different scenario for you. And when we say outdoors, you're outdoors all the time. You might be around other people, but we all know, especially going through winter, we've all been stuck indoors. We see this peak coming down just before we're heading into spring and hopefully going to be able to be outdoors more. That if you're outdoors, well-ventilated environments, your risk of potential exposure to COVID is significantly reduced. And that's true in the workplace. When you look at your workplace being indoors, you're indoors all the time, maybe it's a tight environment. There are going to be some challenges there that employers and employees need to be aware of. First and foremost, employers have a general duty to provide a safe workplace to employees that is free from recognized hazards that are likely to cause serious injury or death. Certainly throughout this crisis, COVID has fit that bill. It can cause severe illness. We don't know how it's going to impact each individual person. It's different. It can cause fatalities. But as we continue to get vaccinations and better treatments, that risk characteristic is declining because we can take care of people better. And if we're vaccinated, we're not very likely to have a severe outcome. Some industries are going to have stronger standards. Hospitals, for instance, nursing homes, some of those places where you will be treating people with known COVID, they're going to have different expectations. But for our discussion today, general workplaces, manufacturing, offices, employers are going to need to be thinking about how they protect employees from COVID. And that may or may not include face coverings. It kind of depends on what's happening in that workplace if you're socially distanced. We work with manufacturers throughout last year. I know for a fact that many manufacturers were tracking vaccination status and were doing very well with 60, 70, 80% of all of their employees being vaccinated. You might see something different in that kind of workplace. For an employer that's not tracking that kind of information, you might see a tighter plan. Employers might need to consider requiring face coverings, where even though DHHS and CDC might change their face covering requirements depending on the nature of the workplace. They need to consider reasonable accommodations for those folks that may not be able to wear a face covering because of some type of medical condition. And always keep in mind, in our communities, I know it says workplaces here, in our communities, not everyone will be able to get vaccinated. Now, it's been shown by the CDC that it's quite rare that for certain underlying medical conditions to cause someone to not be eligible for vaccination, but it does happen. We see this with certain people going through transplants, with certain types of cancer treatments and others. And we want to be mindful of what's going on around us and make sure that we're doing all we can to protect our communities. And for all employers and employees watching, always remember that MIOSHA establishes minimum standards. Employers can evaluate their workplace and implement much stricter, stronger protocols if they believe those are the right things to do for their workplace. And again, vaccination is the key to workplace safety. As I showed you on that previous slide, you can still get COVID, less likely than somebody that's not vaccinated. The outcome, that ultimate outcome, is very unlikely if you are vaccinated. It certainly does happen. There are people watching that know somebody that's been vaccinated, boosted, and has been either very, very sick or has died because of COVID. I can understand that, but just across the board, the stats are clear. Vaccinations work. Next slide, please. So what I want employers to understand is their workplace. Understand where you're at on your safety protocols and vaccination. So what I'm showing you here is on the left side, about 89% of Michigan's workforce falls between the ages of 20 to 64. You don't really need to study those numbers, but it's almost evenly distributed, about 20% per age group. And if you look at the right-hand side, this is the vaccination rate, fully vaccinated, 2 shots by age in Genesee County specifically. We can drill down. You can find this on the vaccine dashboard. You can pick counties, you can pick age group, you can pick almost anything you want. I don't put it on this graph, but I want to give big kudos to all the women out there, because throughout the vaccination stage of this virus, women have been outpacing men by about 5 percentage points across the board, across all age groups, over and over. This is cumulative, so it's going to show the total is going to be a little bit higher because women have been outpacing men. We don't know if these are all workers either. So I want employers to understand their workplace and make sure that they're trying to recognize the potential risk of COVID exposure in the workplace. And what you can see from this graph is the younger your workplace, the lower the vaccination rate. So if you pictured a workplace based on this graph of all 20 to 29-year-olds, the employer has not been asking about vaccination status, it would be reasonable to presume that less than 62% are not vaccinated. So your COVID exposure is going to be different in that type of workplace than it would be if we get to the 50 to 64 age group. That's about 67% vaccinated. And cumulatively, it's about half. So if you're not managing this, you're not looking at this, your workforce is kind of across the board in line with how our labor force looks, you're going to presume that about half of your employees are not vaccinated. And that's going to change what you do in your workplace to make sure it's safe. Let's move ahead. So one thing employers need to be doing out there is just establishing workplace procedures. I want to be clear here that there are no specific MIOSHA or OSHA standards specific to COVID and setting out those rules. We all saw that in the courts a few weeks ago and all the things going on with that. So this falls under the general duties. So employers, to make sure that they're providing a safe workplace, plans are important. And they need to examine and update those policies as conditions change. As I showed you on the vaccination status, one workplace may be different than the other. They might consider face coverings when they're necessary. Always make sure you're training employees on new procedures and policies. If you're an employee watching, and if you haven't been trained or haven't been told, ask your employer. You can't really implement a plan if you don't know the plan. And then keep sick employees out of work. We get a lot of questions about this issue and we get calls on it. And it's a challenge. But there's a Public Act 238 of 2020, which protects employees from retaliation for having to miss work because they've been exposed to or diagnosed with COVID. That is the tool that is protecting employees. It actually creates a duty for the employee not to report in those circumstances. The language is specific, so I encourage you to look at the language to make sure you fall within it. The challenge with the law is there's no administrative remedy, so it's not a complaint to MIOSHA if your employer does that. It's actually filing in a court. So it makes it a little more challenging for employees to take advantage of, in my opinion, but it exists, and it creates an obligation for employers and employees to make sure that we keep COVID out of the workplace, because the number one thing we can do is keep COVID out of the workplace. So that might be continued health screenings if you're doing those types of things. You don't necessarily have to do that, but it could be part of your COVID plan. Next slide. And then social distancing. We know it works. As I said, we know face covering, social distancing, less congregation, less density. All of that stuff works to make sure that we're less likely to pass the virus to one another. And I have current guidance highlighted here because as we have all heard today, we expect some updates from the CDC this afternoon, which OSHA and MIOSHA have been referring to for expectations for employers. Those are not hard and fast. You have to do it all, but that's what employers should look to for good guidance to make sure they're doing the right things in the workplace. So this could change. Don't write it down as the gospel. We're going to be updating as we continue to move through COVID. But social distancing, just trying to make sure non-vaccinated people or otherwise at-risk employees stay 6 feet apart. Employers may consider more stringent requirements. Next slide. Face coverings the same. This is current guidance. The recommendation is to provide employees with face coverings. Definitely consider requiring non-vaccinated or vulnerable to wear face coverings. Consider vaccinated folks wearing face coverings when we have high or substantial transmission. And like I said, we know this works. And employers can always do more stringent requirements. So as we see changes to guidance, if an employer says everybody in here is wearing a face covering, that's fine. They can do that, and it's not a bad idea. Next slide. And we still have a hotline. We started this right away when COVID popped out of the scene. I think we launched it in early May of 2020. We've been very excited and thankful that we've had it at 855-SAFE-C19. That gets you right into the MIOSHA experts. You can ask them questions about COVID, what should be happening in your workplace. If you're an employer, they will help you identify and implement things that can happen in your workplace to deal with COVID. It's been a great tool used by employees and employers, and very, very wonderful operation as well, because the average wait time has been about 30 seconds to get connected to somebody in MIOSHA throughout this crisis. So very proud of that. We have tools available. We're here to help. We want to make sure that employers understand what they can do and should do, and employees understand what they should be seeing and what to do if they're not.
Thank you so much, Sean. Really appreciate that update. Something you said really resonates with the purpose of the webinar, and that's putting a local context to this global pandemic. And you've mentioned several times the importance of us following and then getting updates, but each employer must consider what they need to do to ensure the safety of their employees. So I appreciate that. I do want you to just clarify. You talked about MIOSHA and OSHA. Can you really help us just clarify what those acronyms mean?
Yes, I apologize. I've been saying it so much, I forget that some people might not know. So OSHA is a federal agency, Safety and Health Administration. MIOSHA is Michigan version, considered a state plan, which means our Michigan Occupational Safety and Health Administration has to be, the way we phrase it, at least as effective as federal OSHA. They're audited by OSHA. We need to be in compliance. We have to do certain things. MIOSHA is our state version of federal OSHA. It's bigger because it's a state plan. We have more consultation pieces because it's a state plan. And it's a great asset to the working men and women and employers in the state of Michigan.
So you pretty much get, like, I'll say, the boilerplate from OSHA, and then Michigan has the ability to make some specific adjustments to those rulings.
Absolutely.
Okay. Thank you so much, Sean. Appreciate that. And we're going to ask you to just stay on with us. And for any of our employers, specifically, if you have questions, put those in the Q&A, and I'm sure Sean will be happy to answer those for you. We want to take a quick few minutes with our roundtable. I see Dr. Hackard, Dr. Reynolds, Nurse T, Dr. Deborah. I want to go to you first, Nurse T, because you said something in our pre-show, and you talked about hospitalization. We talked about things changing. Can you talk to us a little bit about what's happening locally in our hospitals?
Hi, everybody. It's Tarnisa from Hurley Medical Center. We are still following the same CDC guidelines. I just wanted to give a quick update as far as visitation. Visitation for adult patients with COVID-19 will be allowed to take place 10 days after the test date at Hurley, or 10 days from reporting positive on admission to Hurley. In-person visits are limited to one designated person, same person throughout the stay, 1 hour per day during normal visiting hours. If you are the designated visitor, You will still have to wear a gown, mask, eye, and gloves, and remain in the patient's room at all times. Please do not touch the patient care equipment. Make sure you're using our hand and foam sanitizer, and do not go to any other place in the hospital. And there is an information sheet and education for when the families and visitors come in. We know that it's crucial at this time to not be able to be with your loved ones, but just letting everybody know that we are allowing visitors, but it's 10 days after your loved one have tested positive, and we have safety measures and education in place. Thank you.
Now, one of the other things you mentioned before you leave, Nurse T, and Sean talked about things trending down, and we've talked about that, but you mentioned that there was a reduction in the number of COVID cases at our hospitals.
Yes, our numbers are trending down. I'm so excited to say yesterday when I was on the line, we had as low as 10 patients, and the surrounding hospitals numbers was below 20 as well. Saginaw area still seems to have like a mid-50, but overall our numbers are trending down. Keep wearing your mask, keep sanitizing, and keep putting in the measures to take care of yourself and your family and the community. Thank you.
Thank you, Nurse T. And now Dr. Pam Hackard, she's really, really busy. And I certainly appreciate our health officer joining us. And actually, Dr. Hackard, I have to let you know, someone thought you were actually the CDC, the CDC program, one of the program directors at CDC. When they heard your voice, they were on the phone. They said, I heard that voice. So you have you have connections and the last name of one of the CDC reps, but you are a local health officer, putting the local context to this. So when we listen to the information that was shared, what would you say from that health officer perspective to our community members? We're not out of the pandemic yet, but things are looking different.
But they are looking so much better. I mean, our numbers are down, as we said. The thing that I'm concerned about, and I want to just ask that people, if nothing else, carry your mask around with you. I know people want to get those masks off. I mean, I have breakouts around my nose, even from it. But keep it with you, because when you get within a few feet of people, or when it's looking like a crowd, you're walking into a store and you see crowds that you weren't expecting, put the mask back on. I mean, it just will save you. And people say, well, Omicron is mild, there's different variants, we have things to combat it, but who wants to be sick at all? And then again, we don't know who it is we're spreading it to, who's immunocompromised, who is vulnerable. We still don't have vaccines for the children under 5. So that's really what I would just like to convey is I'm so happy. We've had 6 weeks now with our numbers going down in Genesee County. And we are so close to going under 100 cases per 100,000, but let's stay there. And then the Omicron, I know you wanted to talk briefly, and I'm not going to keep it very brief, but about the other subvariant, the BA2, and that is probably, they still don't know for sure, but about 30% more transmissible than Omicron, which is of course much more transmissible. So let's just be careful. You can get reinfected even with the Omicron BA2 variant. But again, there's not all that much cases going around in our community. So we can take a slight breather, but be careful.
Thank you, Dr. Hackard. And I saw you, Dr. Wilfred, you're nodding your head.
I just have to agree wholeheartedly with what Dr. Hackard said, and just emphasize that one of the points she made is that we have things to treat COVID, right? That's partly why we have seen things improve. And of course we have the vaccine, but this new variant, we saw with Omicron that some of our medications did not work as well. Whereas we had 3 monoclonal antibodies that might work with Delta, we went down to 1 with Omicron. And now with the new subvariant of Omicron, it seems there's a question as to how well that 1 works against the subvariant. So just to emphasize, with all that unknown, we must wear our masks and be wise. It's like a weather forecast. You have to know when you should take your umbrella. You have to know where you should put on your mask to keep safe.
Yeah, so that's one of the things we said some time ago, partly sunny, partly cloudy. Make sure you're prepared. So that gets to Dr. Reynolds. Dr. Reynolds, I think when Sean was talking, I could just see grins all over your face when he talked about vaccination is the key.
The foundation to prevention of complications. And complications include getting very sick, hospitalization, being on a vent in an ICU, and death, unfortunately. And so vaccination is most important. And then I have another thing to lay on you, and that is when we look at exposure. I'll give you the 3 Ds: duration. How long are you in a crowded place, which is dose, of people who are unmasked? And then you look at your distinct differences or those in your circle. And so vaccination is important for pregnant women, but you do not want to risk someone who's pregnant, who wants to get pregnant, with exposure and the possibility of infection. So you should keep your mask on. If you're not vaccinated, you don't need to be around that person. If that pregnant person is not vaccinated, encourage that person to get the vaccine because it reduces the risks of problems for newborns. And I'll stop there because I really would like to hear an OB, fetal medicine specialist, go into more detail on this. But still, vaccination is the foundation for the prevention of complications. Okay? So, and everything that needs to be said about the variant has been said. And we should be very careful when we listen to the news because they may be talking about a study that was done in a lab, not in people. That's the first step of a study. So the findings there are not always applicable or suitable for what happens in the real world. So you still have to have a degree of care about how you interpret the findings. We have neutralizing antibodies that do things. We have a whole different antibodies that do different things to combat the virus. And this is what's studied in the lab. And it gives us an idea of what happens in people. But don't rush, because if you read a good study, they all say at this point for that subvariant, it's still too soon to say.
Now,
So
Dr.
be
Reynolds,
cautious.
you have brought us a whole nother level of conversation we're going to have. So we're going to put a pin in that. And you always do that. We're going to put a pin in that and come back to it because it is an important conversation. Dr. Hackard, I see you wanted to add.
I did. And I just wanted to add, despite, and it's wonderful having tools, but despite having these tools, just as Dr. Wilfred said, we aren't sure exactly how well they're going to work against this new variant. But also, they're limited in supply. I was on a call and they were saying that there's like 40 doses available for like the UP, and don't quote me on numbers and things, but nonetheless, there are limits of supplies, and so there are guidelines, and so you can't you can't rely on those things. It's basically what it is to get you out, and you're still infectious to others, even with like the antiviral pill that's out there. So limited supply, they're not inexpensive, but really just like try not to get sick. We don't want to get sick at all. And
Exactly.
my poor husband sometimes gets these questions that I ask and say, guess what the average age of people who are dying now is? And it's gone down into the 30s and the 40s. Unvaccinated in your 30s and 40s. So please, 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 people care about, you, and get vaccinated if you haven't been.
Thank you, Dr. Hackard. And again, we're just about out of time. I see you, Dr. Wilfred. Did you have one more little? Okay, we're good. I just want to acknowledge that we had a question. Could someone speak about incidents of long COVID? It's another reason to minimize risk of getting COVID. We're going to have some discussion on that in a future webinar. So please know that we're going to capture that and come back to be with us in a future webinar. So we want to thank our roundtable for sharing with us. And I had a spot here for Dr. Deborah, but I see she had to leave us, but we wanted to get a little bit more of some data in here. So Mary Catherine Crawford is going to give us an update on some data. Mary Catherine.
Hi. Okay. Yes, I'm subbing in today. So if you aren't looking at the health disparities dashboard every week, basically what we just need you to know, the important data coming out of this is that cases are substantially dropping week over week. So this week we saw cases decrease in Genesee County from about 500 to 200, and confirmed cases in Flint decreased by more than half, from 77 to 31. We're also seeing, this is about the 6th week in a row that we've seen the positivity rate decline in Genesee County. And that drop was from about 15.3% to 10.5%. So I remember saying last week or 2 weeks ago that I hoped to be back presenting data that still represented the drop. So it's good to be doing that.
Thank you, Mary Catherine. And as we talk about the whole issues around equity, we want to ensure that no one in our community is left out. And sometimes we have various population groups that seem not to be thought of, but we want you to know today that one of the groups that we're looking at is what's happening with our homeless participants, our community members during COVID. And we have Tracy Jackson with us today, who's the Vice President of Community Development at Metro Community Development. And she's going to be followed by Linda Belsky, who is the Shelter of Flint CEO, President and CEO. I want to welcome them both at this time, because we're going to talk a little bit about what's happening in our community for our homeless, and there's different terminology, and I like to get it right. So you help me with because people are at different places of homelessness, and that term isn't as well as often used. So what's the new language around that, Tracy?
The people that are experiencing homelessness is the terminology that we like to use. If you are experiencing homelessness.
Because that happens in a lot of different ways. It's not that they're outside, they just may be moving from place to place. So what's an overview from Metro Housing?
Okay. Yvonne, first of all, thank you for having us on, and thank you for giving us an opportunity to give you an update. So the Flint Genesee County COC, let me explain what that is. It's a collaborative funding and planning approach that helps us plan for and provide as necessary a full range of emergency, transitional, and permanent housing and other services to address various needs of homelessness. And so to that end, let me give you an overview of what we're doing. We're operating at full capacity with modifications to remain safe, to mitigate the spread. And so right now we are operating 10 housing programs that are administered through the COC programming and the MIOSHA ESG. We have 5 shelter programming that are operating. That represents about 350 people in a congregate setting. And so the CEOs of the shelters have not taken their foot off the gas. They are always looking to mitigate and to keep their residents safe. We have 2 housing voucher programs as a continuum. We have prevention programs. These programs are designed to keep people from experiencing homelessness. We have 2 outreach programs where people go out into the community and bring them into the services that they need or have the services there, meet them where they are. We have a warming center that's open from December to March. We have worked with 2 medical providers, that's GHP and Hamilton, and then we're working with the GHS for the mental component. All of this is occurring while keeping in mind to keep everybody safe. In January, the shelters became concerned about the Omicron variant. And so we saw a spike. With that, we reinitiated our COVID-19 calls. And on that call are the shelters as well as the resources. And so as they bring these concerns, we try to have the resources there. So at the time in January, the shelters wanted more testing kits and or the warming center. They needed help with administering the testing kits. They needed additional space to house those that tested positive, and they would move them to hotel motel if they didn't have space in their current designated COVID-19 spaces. And I'm happy to please on that to report on that first call, all of the resources were there to help mitigate, slow down the spread. And so we have seen, just like everyone on this call has stated, we've seen a reduction. And to that point, I am going to bring Linda. The shelters have worked very closely. They have one voice. They have different variances and nuances in their shelters. So it's a pleasure for me at this time to introduce you to Linda Belsky, CEO of Shelter.
Hey, Linda.
Hi, Yvonne. Hello, everybody. Thank you so much for having me today to talk about the Shelter of Flint. As Tracy suggested, Shelter of Flint does operate an emergency shelter, but we have a lot of other programs that we operate as well, including outreach and permanent supportive housing and ongoing case management and lots of things. We have multiple programs, but I know that we're discussing very specific things about shelter and response with COVID-19. It has been a couple of years of one heck of a ride, which it has been for everyone. And I can say that I started the very week that Michigan shut down. In my role here at the shelter, though I have a long history with the shelter, serving on their board. And immediately, even, I can't say enough about the support from the COC and our partners, but immediately, Dallas Gatlin from Carriagetown Ministries and Deborah Hayes with My Brother's Keeper, the two other emergency shelter programs in our community, and I were discussing our response and working from day one on protocols that needed to be in place. So specific to the Shelter of Flint is a family shelter. So we take women with children and men with children and families. And so at any given time, we have about 60% of our residents, which we can house 75 individuals. About 60% of them at any given time are children. And it is a congregate living setting. So, our families at times are sharing rooms with other families that they just met as they are experiencing homelessness. So there have been, I think, there's been one constant, and that is that I know not to get into a rut thinking I know what's going to happen. So we adopted, the most stringent, with the help of the COC, with the assistance of the Michigan Coalition Against Homelessness and MIOSHA, and the CDC, of course. We adopted the most rigid standards just to begin with. Masks are still required and have been required since day one in the shelter. When vaccinations became available, we provided, working up to that, we provided education and one-on-one sessions to discuss, challenges, whether they be medical or just fear or, whatever came up. We sat down to talk with each individual, staff members as well as our residents, to discuss what could help them take that next step in protecting themselves and others. One of the biggest challenges for us is that we have constant discharges and admissions. So the vaccination of those, living with us here in the shelter, it has stayed quite low. The highest we got at one point was 24%, and we were like over the moon. We have but our staff, because I think one of the reasons is because they understood our population and the coming and going on a daily basis, and then admissions and discharges. Since vaccinations have been rolled, have stayed over 90% with staff, and today we're at 94% vaccination rate with staff. There have been questions and, you know, thoughts about making different mandates, you know, with staffing, and it didn't make sense. When we're working with such a high risk and vulnerable population, it only made sense to maintain the most rigid, you know, mask expectations and cleaning and hand sanitizing. And I never thought I would ever be just teaching kids how to wash their hands. And, you know,
Yeah.
there's all kinds of things we've been doing lately that we've never done before. So,
So
yeah.
Linda, this is really, really important. And we're glad to know the level of effort that's gone in to make sure that the families are safe. If anyone needs to know how to get in touch with the Shelter Flint, because they may know of families that may need the support. And I know for you, Tracy, you've got a number, it's more than Shelter Flint, but there are other places that are available. How do people connect? Because we have a community health workers and social workers and others who reach out to community on a regular basis. Who do they call? What number do they call?
So there is no wrong door. However, there is a process with our coordinated entry by which everyone will eventually, regardless of who they come in contact first, will be directed to. And Tracy, the number, I know you've got it right on the tip of your tongue.
Yes, I do. It's 810-544-HELP. 810-544-4357.
Thank you, because I was going to ask you for that, 4357. So we will put that into the chat so that those that are in the webinar can get it. But we do want to repeat it one more time because we do have listeners on the phone. So if you give us that number, this is for anyone who is experiencing homelessness, to get in touch with this organization, Shelter Flint, Metro Housing, so that they can be in a safe space. What's that number one more time?
That is 810-544-HELP. 810-544-4357.
Thank
And
you
that's
so
the
much.
entry gate, and then we will connect them to whether it's the HARA, Shelter of Flint, One Stop, Carriagetown Ministries, MBK. We will make sure they get to the right resource.
Thank you so much. Thank you, Tracy and Linda, for joining us today. And be sure to come back anytime in case there are questions that only you will be able to give us the answers to. Thank you so much. And we're going to transition quickly to our City of Flint updates. And in the City of Flint updates, we also have some more vaccine conversations for you as well. Lottie, thank you for being with us this afternoon.
Yes, good afternoon. As the slide indicates, we've got upcoming sessions for residents to give us your ideas. We want your input on how the city should spend the American Rescue Plan Act dollars. We've already had 2 sessions. The next session is March 3rd from 6 to 7:30 p.m. at Flint Community Schools Accelerated Academy. That's the old Scott School. And then March 8th from 6 to 7:30 at IINN on 4800 North Saginaw Street. We really want residents to come and give us your input. If you're not able to do that, you can always use input@cityofflint.com to share your thoughts and ideas. Also, as you mentioned, we've got vaccine and testing clinics at the Flint Police mini stations. Hasselbring Senior Citizen Center, tongue twister, is Monday from 10 to 2, on Mondays from 10 to 2. North End Mini Station, that is Wednesdays from 2 to 8, and the Small Mall Mini Station is on Fridays from 10 to 2, and this goes through April 22nd. And lastly, it's as we close out Black History Month, the City of Flint has been celebrating entrepreneurs in the city, Black-owned small businesses. And so if you would, please go check out our social media channels and support the small businesses that we have shared with you over the course of the entire month.
Thank you so much, Lottie. And we're just going to pick up and go into the health department with Sherelle, talking about our clinics. I want to invite Sherelle to come and join me, as well as I'm going to invite Kenyatta Dotson. We're going to talk a little bit in roundtable fashion here about vaccinations and vaccination sites. I know many of you have heard already today the importance of us keeping these numbers down. Sean mentioned everyone can't get vaccinated. So we want to make sure that we acknowledge that, but we do want to make sure that everyone knows that these clinics are available. So I want to talk to, excuse me, want to just talk a quick minute with Sherelle. And Sherelle, the health department has put these clinics together for a number of weeks now, and continue to put the clinics together. And so that's been one of your primary roles, but your roles are expanding at the health department. But these are important clinics that are going to go on. But the other thing we want to really point out today is our pop-up clinics. Yeah. The pop-up clinics, in addition to the ones that are standard, we have pop-up clinics. There's one coming up this Saturday, or tomorrow, actually.
Yes, there will be a pop-up clinic at our Gateway Church. That will be taking place between 12:30 and 2:30 p.m. I do want to mention that you must be 12 years and older to attend those clinics. And we'll have the Moderna and the Pfizer shot. The CDC and ACIP are recommending that individuals do receive the mRNA COVID-19 vaccine, which is Moderna or Pfizer. But any vaccine is better than none or not being vaccinated. So if indeed someone does want a vaccine outside of that Pfizer or Moderna vaccine, they must request that Johnson & Johnson vaccine, and we'll provide that as well.
So thank you, Sherelle. I asked Kenyatta to join us today because the health department is going to be working closely with community organizations and churches to have additional clinics set up in addition to the ones that are the regulars. So here's one at Church Without Walls. And so ask Kenyatta, give us some more details about what's happening on Sunday. We have the Saturday clinic at Agape, and then on Sunday at Church Without Walls. Kenyatta.
Hi, yes, thank you. Thank you for having me in this space. I truly appreciate it. And also appreciative of partners like the Health Department and Michigan United being able to offer this type of opportunity and resource to the community. So we were devastated to hear, as we've been hearing information, that the city of Flint, and I dropped a link in the chat for the Health Department where much of this information can be found, but that the city of Flint is one of the highest among cities that has the highest number of cases, COVID cases. And we want to reduce that number. And I think one of the best ways to be able to do that, one of the best ways to make sure that we're safe, our families are safe, those we love, those we serve, is by making sure the information is disseminated throughout the community, and also to make sure that we're making resources and these types of opportunities for vaccination services, resources accessible to people right in the neighborhood where we're eliminating barriers. So we've partnered with the Health Department, with Michigan United, and we're going to host a pop-up clinic, COVID-19 clinic right at Church Without Walls. You don't have to come to church. It's going to be from 9:30 a.m. to 12 o'clock noon. All you have to do is walk in with yourself, bring your family, bring your friends, bring whomever wants to come, and talk to the health professionals and the health partners that are on site and get vaccinated. And from there, you can stay if you choose to. If you don't want to stay, but you just need to talk to somebody, we have a host of social workers and other caring professionals at the church who you can talk to if you just need to talk to somebody. So just let us know that, and we'll be on hand and on site in order to help and to serve you. So that's what we will be doing on Sunday. And Yvonne, I think you have a flyer that we can put up really quickly.
It's up.
Okay, great. Yep. So you all see that, and we'll send that out. I think we can send that out to everyone who's on the email list as well. And I also just want to share too, on that site, it identifies cases, COVID cases by zip code, and you all will be alarmed to know that Like the 48507 zip code, 48439, and the 48423 are the highest zip codes with the highest cases. And we want to reduce those numbers because those aren't just numbers, those are people. And once we get information out and we talk to our family, our friends, and we encourage them to be as informed as possible, then maybe they can also be as healthy as possible.
Thank you so much, Kenyatta. And Sherelle, we just want to appreciate you and all the work that you've done, because there are also the clinics that are set up. And this is a partnership that's happened with HANU. Again, those 3 sites that you can go to and not only get your vaccine, get tested, but you can also get vaccinations at these sites as well. So for those of you that are on the phone, don't forget, and I'll let you just mention the names of these locations, Sherelle.
Okay, I also wanted to mention, just as our pop-up clinic on Saturday, on Sunday, that age requirement is 12 years and older as well. So be mindful of that. But our testing and vaccination sites do include the Word of Life Church, Bethel United Methodist Church, and Macedonia Baptist Church. Word of Life takes place Tuesdays through Thursday from 12 p.m. to 6 p.m. And Bethel United Methodist is available on Tuesday and Wednesday from 10 to 4 or 1 to 7. So you have that morning and evening option. And then on Mondays, Fridays, and Saturdays, Macedonia Baptist Church does walk-in testing and vaccinations from 10 a.m. to 3 p.m. But it is we want you to schedule an appointment before coming to these clinics, just because there are an increase of community members coming to get tested every day and receive their vaccines.
So this is really important, because we do have these sites available. We also have some other local sites that are available, and we've talked to you about these sites over the week. So please be mindful. If you can't get to those 3 sites, you can go to Walgreens, Hamilton Community Network, or Rite Aid and get your vaccines there. We also want to remind you that you can get additional support. And I think this is important, again, Sherelle, because the information is available in both English and Spanish if individuals need to call to get some help at home. And I just want you to give that number out right quick. For those who are listening by phone, there is a phone number, a call center that you can call to get support if you need assistance in your home.
Yep, that number connects you directly to the health department. That phone number is 810-344-4800. You can also visit our website at gchd.us to fill out a survey to be registered for an at-home appointment.
Thank you. And in addition to all the work that the health department has done and that our partners have done, there is also a site, a drive-through testing site in front of the Ashley Home Store parking lot on Linden Road, 3250 Linden Road. They also require you to pre-register. We put this information in the chat on the screen here, but if you are listening, you can call 248-781-8318, 248-781-8318, and schedule your appointment for getting a PCR test. That's the PCR test that you can get at that site in front of Ashley's. The team there is biotech. Ashley's Home Store is making sure this is available. We're fortunate in this community, and I'd ask one of our partners if around the country they've seen anything quite like this for the size of our community. We do have a number of testing sites, but as we've said before, vaccination is important, testing is important. We must do all of these things to ensure the safety of our community. And so more to come on that. We have had a wonderful session. I want to thank all of our partners for sharing with us today. And for those of you that are listening in, thank you for giving us insights and ideas for upcoming webinars. We've got some really important ones that are coming up. We're going to be talking about in the future actually next week, we're going to be getting some insights on the Flint registry. So for those of you and have asked questions and are interested in the Flint registry, come next Friday, and you will hear information about the Flint registry. Now, let me say to those of you that are looking for those continuing education units and contact hours, please wait until just a couple minutes after the webinar and fill out that survey so that you can be prepared to get your CEUs and your contact hours. We also want to remind you that next week we'll go into a little bit more detail. So for those of you that have seemed to have a little bit of a challenge, we'll be addressing this in more detail next Friday. I want to thank you for joining us today. We want to ask you to continue to join us. Let someone else know. You can like us on Facebook, subscribe to our YouTube channel, Healthy Flint, or email us with any questions that you might have, or if you need more information, info@hfrcc.org. That email address is info@hfrcc.org, or you can give us a call at 810-835-2130. That's 810-835-2130. And we're going to ask you, please join us next week for session 103 of the Healthy Flint Research Coordinating Center's community webinar on coronavirus. Thank you and have a wonderful week.